So welcome everyone. Welcome to all the participants, and thank you for joining us to the panelists to this webinar, Thinking Differently: A Look at Canadian Cities' Immediate Response to COVID-19, and to make space for social distancing. So I'm going to do a bit of introductions. We're going to have you say a few words about yourselves. Then we'll go into some question and answer discussion between the three speakers, and then we'll go to Q&A to the participants. So for the participants, there is a Q&A button at the bottom of your screen. You can insert questions. You can ask questions as we go through this webinar, and then we will go to those questions at the question and answer component of the webinar. So I have read so many articles over the past several weeks looking at the challenges of physical distancing and the opportunities to increase our active transportation. I've seen headings like, you know, this is a defining moment for the future of urban mobility, and that we need to build back better, which I really like that idea. And it feels a little bit like we might be in a tipping point. To be able to bring people from different diverse sectors like transportation and public health, environmental, climate change folks, our injury prevention, physical activity, mental health, or urban planning. There's just so many of us working together towards similar outcomes, but coming from different perspectives. And it seems like this might be an opportunity to collectively push for some of those changes that would move all of those agendas forward, but result in a more safe and healthy experience for everyone. So we're pleased to have the three panelists with us today. We have Bartek Komorowski, Planning Advisor, Road Safety and Human Behavior, Ville de Montreal, who is an urban planner by training and has worked in the field of active mobility for 13 years. Prior to this, Bartek spent 7 years as a project leader in the research and consulting department at Vélo Québec, Canada's largest cycling advocacy organization. He worked with numerous municipalities in Quebec and Ontario, planning, designing, and on the maintenance of programs for pedestrian and cycling infrastructure. And he is the co-author of Vélo Québec's just released design manual, Aménager pour les piétons et les cyclistes. We also have Dr. Linda Rothman, who's the assistant professor, School of Public Health at Ryerson University in Toronto. She has been and is a senior research associate in the Child Health Evaluative Studies at the Hospital for Sick Children. And her professional interests are in injury prevention in children. Most recently, her work has focused on child pedestrian injury, the environment, and active school transportation. Some of her other injury prevention work has been related to playground injury, hockey, child motor vehicle occupant protection, and injury prevention policy. And recently, she co-wrote an open letter to the City of Toronto calling for a rebalancing of streets to protect residents who rely on sidewalks and bicycles for their essential transportation from both COVID-19 and from road traffic injury. We have Brent Toderen, urban design and planning consultant at Toderen Urban Works in Vancouver. He is the owner and consultant at Toderen Urban Works and is a former director of city planning for the City of Vancouver. Also has worked as the manager of Center City Planning and Design and chief subdivision planner at the City of Calgary. Brent has over 26 years of experience in advanced urbanism, city planning, and urban design, and he assists cities, agencies, and progressive developers in creative and responsible city building from around the world. So I think this is going to be a very interesting conversation. So could each of you briefly talk about why you're so passionate about this topic and have undertaken the work related to safe transportation and urban and city planning? Maybe Brent, we could begin with you. Brent, did you want to start?
Hi, I just got back in. If you've been talking to me,
Oh,
my apologies. It froze and booted me out. So,
oh dear. Okay. So I was just doing the introductions. You know what you've done, so you haven't missed much. But could you give us a brief overview of, why you're so passionate about this work and why you've undertaken the work that you have around urban and city planning?
why am I so passionate? Well, I'm a city planner. My company is Totter and Urban Works. I'm the former chief planner for Vancouver. I've always taken a bit of a different approach to my work from a passion perspective. I tend to believe that and observe that our planning profession, city planning profession, doesn't have nearly enough passion, is not nearly as persuasive enough as it should be in the context of better city making. So I've always been a little more noisy and pushy, if you will, about making sure we have the right conversations with the right information and the right level of persuasion. I think we have badly needed to improve many elements of our cities, including how we organize and prioritize our street space for a long time before this pandemic. I don't use the word opportunity. For those who follow me on Twitter, you'll see a tweet I sent out just this morning of why I avoid that word, because it's tending to make people mad at us for saying opportunity, like we're somehow happy this has happened. I use the word responsibility. We've had a pre-existing condition that required a lot of change. We had a pre-existing responsibility. If anything, the pandemic makes me feel that the responsibility has even been heightened for us to do better, do faster, and do more.
Great, thanks. Linda, did you want to tell us a little bit about why you're working in this area?
So it's interesting how my passion in this area started. I came from this as a health professional originally. I was an occupational therapist who ended up going into public health epidemiology and very kind of focused on child injury prevention, hospital-based, and then bit by bit over the years and a late PhD and postdoc, I became more and more involved in urban environments and ultimately in affecting some city planning, which has been a really, when you talk about passion, Brent, it's like, I realized that, when you're focused in a hospital-based setting, you don't get to see a lot of the real outside world other than what's coming into the hospital. And now all of a sudden my background in public health is being used to help shape and form how I think road safety and cities need to develop going forward. To me, it's really exciting because it's not just health professionals, but it's urban planners, it's architects, it's transportation people that all have to work together on this one problem. And the conversations that to me are really stimulating to see how people can approach these things in a different view. But also we've got, some issues around equity in the city where we have our road traffic design tends to be, our road safety design, things happen to be more in high income areas. So there's equity issues that we have to talk about. And also with this new reality, there's equity issues regarding who's driving, who's got cars, who's walking, who's cycling, and where they're walking and cycling. And coming from an injury perspective, there's a lot of issues around higher speed traffic and people walking on roadways to be able to maintain physical distancing. So to me, the passion has come out of health and has moved into urban environments and urban planning. And I love to hear what everybody else has to say.
Great, thanks, Linda. Bartek, do you want to tell us a bit about yourself and why you're passionate about this topic?
Sure. Well, a bit like Linda, I sort of arrived where I am today indirectly. My first university degree was in cognitive science, and I became very interested in how people interact with built environments, which is what really led me to urban planning and then later specifically into active transportation. So, I realized that myself as a bicycle user, a long-time bicycle commuter, that I think, we're limited, our choices are limited by our environments. So we don't use certain modes of transportation, or we don't get around in a certain way around the city because the city doesn't invite those things. So that's what drove me into this field in general. And then more recently, I'm working on visionzero at the City of Montreal. And what attracted me to visionzero is that it entails a paradigm shift in the way that we're thinking about city planning and mobility. Mm-hmm. And it's a real opportunity to rethink how we shape the whole system. And it's an opportunity also to create overall a system that's going to be more inviting to people to use other modes of transportation, especially other than the car. And actually, I think we'll probably touch on this repeatedly over the next hour, but this COVID-19 crisis is actually kind of accelerating some of this change. So car traffic is down right now, and we have this incredible opportunity to reappropriate parts of the space that was usually dedicated to motor traffic, and to change the environment and try to invite people to get around in a different way.
Yeah, I think the that idea of the systems approach, the inclusion of so many different sectors that have a role to play in this is really key. So thank you all for sharing that with us. I'm going to ask you all to respond to this first question, which I'm hoping that you'll be able to do. So what grade would you give the cities that you each live and or work in, respectively, on how they have responded to and made changes to road usage for pedestrians and cyclists with this social distancing and COVID-19 situation? How are the pedestrians and cyclists using your city streets right now? Linda, do you want to start?
Well, I know, Pam, you're in the same city or on the outskirts of the same city as I am. Up until now, I would give it a good F fail. But I want to put a plus beside it at this point. We did have some issues getting started on the conversation. Myself and my colleague, Ann Harris from Ryerson, did, I think, help to initiate some of the conversation with the mayor and Dr. Davila here in Toronto. It did take Toronto a while. It is taking Toronto a while to get on board with some of the changes that we've been proposing or people have been proposing. But the plus on top of the fail is that there is a conversation happening right now. There was a call for, I don't think the document's been released yet, but something called Active TO, where they are starting to look at some road closures. So we have not done a lot. We did a little bit of curbside adaptations, I think in 10 locations in Toronto. We have not closed off any lanes. We have not closed off any streets, but there is some conversation happening around it, which is positive. So F plus. I think would be my grade at this point, but with positive looking forward.
Right.
Continue conversation.
Spoken like a true professor. Brent, can you tell us a little bit? How would you rate, Vancouver? What's going on in that city?
I'm just marveling that you gave Toronto an F plus and not an F. That was a very generous plus. Vancouver, well, I'll talk about Vancouver and maybe the rest of Canada because I work across the country and around the world. Answering this question is always tough. It's like, how do you grade? It's like the conversation we have about our kids. If you grade tough, will it motivate them or will it just wreck their self-esteem? If you had asked me this question about Canadian cities and including Vancouver probably 4 weeks ago, I might have given Canada and Canadian cities a solid A-, because Canadian cities were actually one of the first groups of cities to take some level of action. Not every city, as has been pointed out, Toronto and Ottawa were nowhere. But, and even worse than nowhere, they were actively arguing that things didn't need to be done, which makes it even less than an F, perhaps. But cities like Calgary and Winnipeg, which were surprises because both are known as sort of car-friendly cities, but cities like Vancouver and Montreal were had launched things. And they took a little while by my standards because I was watching what Latin American cities were doing, and Latin American cities were really quick because they had the culture and the skill sets already to do this. But Canadian cities were certainly ahead of American cities, and when we were comparing them to, say, New York City at the time, which was just in complete denial, I would have given them a pretty good grade. Here's the problem. In the 3 or 4 weeks since then, most Canadian cities haven't done anything else. They did initial pilots. Some of them stopped the pilots and didn't continue them. And even the ones that did continue what they did didn't follow up, didn't go further, even though the conversation had been going much further about the need to not just do a few one-offs, but do something that was networked, hyper-local, as I call it, very ordinary and non-sexy, not destinations, but places that are everywhere and well-connected. And other cities on our continent, in North America, in America, for example, Oakland, California, Minneapolis, Portland, eventually New York, and many others started outpacing us dramatically. Oakland, California, with 72 miles of their streets open to people for walking and biking, 10% of their complete road space. So now I give Canadian cities maybe a B-. And in some cases, the cities that have actually stopped the pilots that they've done, maybe they're down to a C. In Vancouver, we reasonably quickly closed the roads to cars in Stanley Park, and importantly, Beach Avenue, because we were looking at pinch points, the seawall being a very tight place where a lot of people wanted to go. And so a couple of strategic important moves were made, and there's a good discussion going on about whether those changes should be permanent. But what I'm disappointed in is the lack of a larger context, a more hyper-local context where it isn't about people going all the way to the seawall or all the way to Stanley Park, perhaps risking their safety and going those far distances to get there. What I've been calling for is, as I say, a hyper-local approach for some time. And American cities, some of them get the A, and we probably get the sort of B- at this stage.
Okay, great, thanks. Bartek, what would you grade? What would you grade your city, and you know, could they be doing more? And any lessons learned that you've seen over the last 2 months?
Well, if it's okay with you, I'm not going to grade my own city as a city employee. It could be a bit of a diplomatic problem.
All right, we'll give you.
However, I can describe what we've been doing and where I think our strengths are and things that we need to improve. So I would start by saying Montreal has a kind of a complex governance system. We have a 2-tier city government. So we have boroughs, and then we have a central administration. And I would say that our boroughs have been really quick to respond, particularly on streets that are under their management. So we have dozens of local shopping streets. So it actually aligns well with what Brent has been saying. So it's been a very local approach. It's like, how can we make sure that you can get your, what in French we call service de proximité, so like nearby services and shops accessible. So lots of these neighborhood main streets have all been now adapted. They have at least 1, if not 2, widened pedestrian corridors. So there was a great opportunity. Generally, there's less parking now on these streets. Mm-hmm. So it was actually fairly easy and uncontroversial to appropriate the space allocated for parking and to use it now for pedestrians. And also, I'm hearing myself.
Yeah, a little bit of feedback there.
Sorry. So I'll try to lean away from my laptop. Also many of the boroughs are doing is they're doing these kinds of approaches like we've seen in Oakland. So slow streets or shared street approaches. So far, every borough, that's the other kind of problem with having this, having 19 boroughs and each doing their own thing, is they all have different names for them. But largely what this amounts to is that they're partial closures of these streets, where basically we're telling people that only residents are welcome to drive here, and otherwise the pedestrians can use the whole street. And there's plenty of these. It's actually it's hard to account for all of them because there's so many projects across the 19 boroughs. And then the central administration, which I work for, we're working on something bigger, which will be more citywide. So, and in a way, it's like a super network that's going to kind of link up all these things that the boroughs have been doing. And it's very actually important for us to do this. It's a network of pedestrian and cycling routes, which are not just linking neighborhoods to the city center, but they're also linking together parks, because we're very aware that a lot of people won't be leaving this summer. They'll be spending their vacations or their whole summer in the city. So we need to actually create more space for recreation, not just for mobility and transportation. So that's what we're working on. So stay tuned. There's going to be some big announcements coming up. I can't reveal more than that for now, but I think Montreal is definitely, what's coming is ambitious. We've been a bit slower than perhaps cities like Paris or Berlin, but things are coming.
All right, well, we'll stay tuned. Sounds exciting.
Yeah.
Linda, you obviously think that, and many of us think that Toronto could be doing more. They could be doing some things differently, and there's obviously some lessons to be learned with what's been happening in other cities. Based on your recent advocacy, the letter that you and Ann Harris wrote to the Mayor of Toronto, Mayor Tory, Toronto has, as you indicated, finally decided to open up some roads to pedestrians and to cyclists. So why did you feel this was so important, from an injury prevention, from a research perspective, that this happened, and that you felt that you needed to speak out in the way that you did?
So the letter was initially motivated by Anne, thank you, because there was concern around the idea that people walking and cycling was an option. There was not any acknowledgement going on that it is actually an essential mode of transportation for people, especially in the downtown areas of Toronto. Lots of people don't own cars in the city of Toronto, and people needed to be able to get groceries, to the pharmacies, and also essential workers needed to be able to get to work. So you've got a city with a high density city downtown with very narrow sidewalks. You're supposed to be maintaining physical distancing, and you've got roadways that have virtually no cars on them right now, and whatever cars are on them are going really fast. We've had a really, really bad issue with speeding tickets, stunt driving going on in the city. And then you have people walking. My neighborhood, I live downtown, kind of in the East End. Nobody's walking on the sidewalks right now. They're walking in the middle of the road so that they can maintain social distance or physical distance from the person on the sidewalk. So you're putting a lot of people at risk of being hit. We have seen that collisions have gone down since all this has started. But what we're also seeing is that when you account for the volume of cars that are going on, the rate of collisions have actually gone up in some cities, and the rate of fatalities are going up. As we put more and more people onto the streets with the good weather, there's lots of people out there cycling and biking and walking right now because they're not at work right now, and this is what they're going to do. It's not so much about essential travel. We have to start thinking more about the recreational part of this as well. We're moving from stay-at-home policies to get out and try and physical distance as much as possible. If they don't have room, I was on the Martin Goodman Trail on the weekend biking. It was terrifying, and I'm a pretty seasoned cyclist. I don't think I'll ever go back there again during this thing. There's a mixture of pedestrians and cyclists all together on the Martin Goodwin Trail with wide open roads beside you, cars going fast, but with very, very little traffic on it. And also the other thing that I noticed is there's a lot of new cyclists, people who haven't ridden a bike since they were 12 years old, on bike shares, on rickety old bikes, stopping in the middle of the pathways. The multi-use pathways are an issue. The bottom line is we're going to get traffic injuries with all this going on. People trying to move onto the roadways because they don't have room. I'm also actually quite concerned about collisions happening on the pathways between pedestrians and cyclists. So it's really important that we start making some space for the increased volumes as the weather gets nicer of pedestrians and cyclists. The other thing that I do want to mention is, yes, all traffic volumes are down right now, biking or car traffic, pedestrian, but I saw some preliminary numbers from the city that hasn't been released yet, so that cycling really isn't down this year. And if anything, it's going to start going up. And as people unfortunately have the fears of public transit, we may see even more people moving to cycling and pedestrians. And that's why we need to really start expanding some of the physical space for people to maintain physical distancing and be able to ride and walk safely. The speed thing is a huge issue. We need to get that under control. We know that speed is the biggest predictor of collisions and fatalities. And if we have a speed issue now with the few numbers of people out and about right now, we're going to have a recipe for disaster later on if we don't fix the infrastructure right now.
Well, and I saw that that some of the Vision Zero plans that Toronto had, the automated speed enforcement, has been put on hold during this period. So, do you have any sense? I mean, I would think that this is a opportunity to positively, impact the Vision Zero plans that Toronto has to accelerate those. What do you think in terms of this impact on Vision Zero in Toronto?
So we actually work with the city. We're doing some evaluations of Vision Zero interventions around schools. And part of the work we were doing was on unabated speed enforcement. Unfortunately, the program has been on hold. Fortunately, the boxes are still up, so we can get the data off of it, and we will be. We're also working on a project right now trying to figure out how to collect volume data, pedestrians, cyclists, vehicle volume data, and relate it to collisions so we can make a case. Vision Zero is supposed to be data driven. So we're hoping we can feed in some of that data into some of the Vision Zero planning going forward about how things are changing and how transportation modes might be changing and how we can affect policy going forward with respect to it. Again, Vision Zero is very focused on speed reduction. We really need to get that data off of the automated speed enforcements. The watch your speed boards are still up, so we're going to try and access some of that. And I do think what's going on right now may help to shape some of the Vision Zero policies and priorities going forward. And again, I think it'll be around speed. And also safe systems, connecting networks, connecting the cycling network. Toronto is talking about putting fast forwarding some of the cycling lanes that we're going to do as part of Vision Zero. And again, I just want to bring up the issue of Vision Zero is very cognizant right now of a social justice and equity lens. All parts of the city need to have equal treatment in terms of what we're doing.
Yeah, that's a really good point. Brent, you recently wrote an op-ed to New York Governor Andrew Cuomo, who's been on the news a lot, distinguishing the difference between density and crowding, which I think is really important during this COVID-19 pandemic. Can you elaborate a little bit more on this and how it relates to the city planning, in places like Toronto and Vancouver, Montreal, and why density is actually a good thing as we look, more optimistically forward to the post-pandemic situation?
I'm almost snickering because you say recently, and that article op-ed seemed like so long ago. It seemed like it was at the beginning when we were just looking to our various leaders for the messaging they were giving. back when we were all still calling this social distancing. And it was obvious that Governor Cuomo, who was doing a remarkably good job comparatively speaking to some of the other American leaders, in his messaging. So my polite, respectful request was that he stop talking about density as being the problem and instead talk about crowding. And we talk about crowding in the context of crowd control, in terms of assemblies of people, obviously big things like concerts and parades and such, but even crowding in the context of household size. I've seen a study that shows that some of the cultural tendencies towards larger household size causes more of a concern relative to viral spread than homes per acre or homes per hectare of traditional density, the way we calculate density. My comment in the article was you can have crowding without density and you can have density without crowding. And indeed, we actually have seen some of the densest cities in the world through good governance and good decisions around crowd control, weather the storms of this pandemic much better than suburban places. Even in New York City, where Cuomo was speaking, the stats showed that there were lower incidents of viral spread in the denser places like Manhattan than in the suburbs. So first point was to rebut the notion that density was dangerous. Second point was more dangerous for viral spread. Second point was to point out all the advantages that urban density gives for more resilient, nimble neighborhoods, including the ability to walk to multiple grocery stores and have an urban hospital with higher capacity and probably a better level of treatment. All the advantages that happen with clustering and concentrations. And recognizing that this is a language issue, but language matters. Just like my comment earlier about opportunity versus responsibility, it's important how we characterize some of these fundamental building blocks of better cities and not vilify them during this pandemic. Since then, actually, I'm not sure if Cuomo has completely stopped using the word density in that context. I certainly haven't heard as much about it, so maybe he has. But because that was a while ago, the conversation has expanded to a much more overt conversation about some of the various attacks out there on urban densification versus sprawl, the idea that sprawl is safer. So let's build more sprawl because we're afraid as a result of this pandemic, or cars versus transit. Transit is unsafe. So let's all drive more cars because we're afraid after this pandemic, even though all the stats show that driving is the most dangerous way of getting around by far. So it's these narratives that have started up, some very deliberately by motivated voices, to push sprawl, to attack density, to push cars and attack transit. And what I'm very concerned about is because of this initial fear that we may feel during the pandemic, certainly, but during the recovery, when physical distancing is still happening, but is less of a concern, will we still stay away from transit? Will we still think density should be reconsidered in the context of how we build cities and where we personally may choose to live? And I've been very concerned about what I've been calling the self-fulfilling prophecies. Canada, for example, is going to be spending a lot, even though we don't have a lot of public money these days. We're going to be spending a lot on catalyst projects, on reactivating the economy. And I've been messaging to the leaders there that because we assume that more people will want to drive, we then allow shovel-ready road widening projects to occur, then more people will drive, not because of the fear of the pandemic, because that will be short-lived, but more people will drive in the long term because of the infrastructure we built, because we assumed that more people will want to drive. We've created a self-fulfilling prophecy. Similarly, because we're assuming that fewer people will want to take public transit, we cut service, which has already happened, and we cut further investments so we don't expand service. And because of that, fewer people take transit in the long term, not because of the fear, because that's short term, but because of the service cuts and the lack of frequency, et cetera. And maybe even because of cuts of density around transit, because people are attacking urban density. And in the medium long term, we end up getting fewer riders, transit riders, not because of the fear, but because of the decisions we made and the self-fulfilling prophecies we've created. So my narrative has expanded beyond that Cuomo letter to be a much more overt push to make sure we're having the right conversation about the real risks coming out of this pandemic. And frankly, the biggest risks we have for cities are about how we react to the pandemic, the self-fulfilling prophecies we can create, and what we can end up doing in terms of damaging our cities because of short-term fear with long-term consequences.
Yeah, and I think that's a really key piece, is to look forward as to what are the investments going to be in terms of infrastructure, and how can we influence those, as you say, to make it more of a positive self-fulfilling prophecy, if you will.
Right. We have to. I'm fine for self-fulfilling prophecies as long as they're good ones. I'm a city planner. I don't react. I don't hope that things are going to turn out fine and that cities will get better as a result of this. We have to be very overt. We have to be very deliberate in making sure that the good things happen and the bad things are avoided, or else our cities and even the implications of climate change are going to get much worse because of this pandemic. And that's not inevitable. That's a choice that is a result of our decision making.
Pam, sorry, can I just respond a little bit? I think also what you're saying is short-term versus long-term. We need to not just focus on what's going to work for tomorrow. We need to focus on things that are going to work longer term. Like if we put up a bunch of barrels to, close off a couple of streets for a short-term gain, it's not going to help us in the long term. So we need to look to the future in some of the infrastructure changes that we're making. Is that where you're getting? Yeah.
Well, yes, and certainly we've seen that in European cities have been much better. And even now, Seattle is the first American city that has talked specifically about permanency in the context of their street transformations, already saying this is what we're going to keep. Because we had pre-existing conditions and pre-existing needs before the pandemic anyway. So we might as well think about what the permanent changes are going to be. And if nothing else, I hope that we have a permanent change in the culture of our cities, because I've observed that the cities that already had a culture and a skill set around street transformation and rethinking streets, they acted quicker and they acted better. So if nothing else, if our Canadian cities have a permanent legacy of a change in culture and skill set around street transformation, that's going to pay dividends in a lot of ways.
Yeah, and Bartek, I think, given your experience both at the city but with active mobility and your vocal advocacy around cycling and the expansion of the infrastructure, building on what we were just talking about in terms of making choices and the permanency of this as we go forward, what unique considerations do we need to think about for cyclists in particular during this pandemic right now, both and afterwards?
Well, yeah, and very much to follow up on what Brent was saying, well, first of all, one thing that's really obvious is people will be very reluctant to use public transit as we deconfine. So the bicycle especially seems like a very good alternative especially for people who are doing sort of short to medium distances. And so if really the bicycle is going to be a major relief system for public transit, it's absolutely obvious that we need to make much more space for cycling, and we need to make cycling much more comfortable than, that's, I think, one of the main barriers, the reason why we aren't hitting double digits in mode share for cycling in Montreal. We have about a citywide mode share of something like 5%, maybe 4% actually, for trips to work. So if we want to move beyond that, even outside the pandemic, we have to create better spaces for cycling, which are protected from high speed, high volume traffic. And actually, the pandemic has given us an opportunity to do this in two ways. I mean, one is we're likely going to accelerate projects that we already had at the city. So the city has been working now for a couple of years on what's called the REV, Réseau Express Vélo, which is a citywide network of super wide protected bike lanes on arterial roads. So some of these plans will be accelerated, and we're probably going to move beyond them as well. So again, as I said, if what we want to avoid at all costs is that those people who want to avoid public transit, that they don't all drive. And so we are proactively trying to offer them another alternative. And already our administration, and I think many of our elected officials as well, are aware that this could go past, this may well go beyond the current crisis. So after the pandemic ends, hopefully when there's a vaccine, maybe some of the space that we've reallocated could stay that way, and that we don't go back to the baseline that we had before. So yeah, I mean, in a nutshell, I think that's where the thinking is.
Yeah, I'll get you to comment. I'll just ask one more question of all of you, and then I'll hand it over to Kelly to bring forward some of the questions that the participants have. But Bartek, maybe you can continue. I mean, you've sort of started this this answer, or this thought, post-pandemic. Like, what are some, do you have some tips for us and the participants, around how do we, what do we do so that we don't shift back to that, we don't go back to normal, as people say, the car dominant roads. How do we use this momentum that we're building as a sector to continue to do that? Are there some specific recommendations or suggestions you have?
Yes, I think, we have as planners right now, I mean, for me, this is an incredibly exciting moment, because it's like an amazing opportunity. Traffic here in Montreal is down by 40 to 60%. There's no more rush hour congestion. So now all of a sudden we can take a whole lane or 2 lanes away on a major arterial road and reallocate it to cycling or walking or both. And right now, I think if we do this and we do it well, and by well, I mean for cyclists, actually for both pedestrians and cyclists, if we create spaces that are safe and that are well protected, that are separated from, either separated from high-speed traffic, or we manage to really calm traffic on local streets, and we create spaces that are very attractive for walking and for cycling, where we eliminate these stressful and dangerous interactions with cars. I think more people will say, hey, it's kind of nice to be able to use the street this way, to be able to walk in the middle of my local residential street, or to ride my bike long distances on these nice, wide, protected bike lanes. Hopefully many people might want to keep doing it afterwards. So I think if I have a message, it's, be bold, try to do what you're doing well, and think of how it could also be eventually made permanent. Right now, there's a need here at the city. We need to do it quickly, but we're already aware that we're going to go back. It's going to be iterative. So first, we're just going to do something with cones and just road markings, and later on, we'll jump. We might come back and revisit it and adjust it, and in the hopes of making it better and perhaps making it outlast the pandemic.
Great, thanks. Linda, do you want to, do you have a couple of tips maybe?
Yeah, there's a couple of things. First of all, I mean, based on the rhetoric, I think, going on in the city of Toronto, my fear is that most of it sounds temporary. I don't know if, Pam, you agree with it, but there is not a lot of talk about permanency, or that's the brief stuff we've gotten from Active TO. Maybe the cycling lanes a little bit. That's my biggest fear. What I do think, to follow up on what you were just saying, is what we really need is some way of monitoring all this stuff. We need the data to prove to people that if you put the bike lanes in, people will use them. If you put the if you open up the sidewalks, people will use them. And also we need the data to show that collision rates are down, injury rates are down. So I think it's great to put all this stuff in, but we really, really need this to be data driven, or else we're not going to convince anybody of anything. It's great to see, you know, my little anecdotal on the Martin Goodwin Trail. There was lots of people on the weekend. Who knows if that was any more than on a regular weekend? I don't really know. I just happened to be out that day. We need counters. We need volume data. We need collision data. We need it fast. And we need it to be able to get to the right channels so that they can make the decisions to keep these things open and permanent. And that's what we're really, our research team is really working towards at this point, is proof.
I think that's really key, and that's what we get asked, you know, that's what we base what we are recommending on is that data. So Brent, maybe you want to weigh in here on, you know, some of the specific things that we can do to make sure that those choices that are made are the ones that we want the positive self-fulfilling prophecy to lead towards.
Well, I really like the comment about data. And luckily there are cities that have the infrastructure in place, the counters already, where they're going to have a good sense of the base case and a good sense of the change. The one proviso I'll make, because I'm big on using data and storytelling as the combination of those two things to change people's perspective out there, including city decision makers' perspective. But I don't want the lack of data to be an excuse for inaction. There are cities out there that are sort of looking for the perfect pilot or the perfect scenario, and it's just an excuse for delay. If we don't have data, we shouldn't do the pilot. And by the way, if we don't have data about the results, we shouldn't make anything permanent. I am fine with the public voice being very influential in this. What I've said is one of the most cynical excuses I've actually heard cities state about why to not do these changes is that people may like them and may want them to be permanent. And there's some cynical truth to that, in the sense that data is influential, but public opinion is what politicians listen to more than anything. If the public champions the keeping of these changes, if the public speaks out in mass numbers, that will influence politicians' decisions, even reluctant politicians like Tory, for example. That's frankly the only thing that seems to influence certain politicians' decision-making. So I think there's going to need to be a large public outcry about keeping the things that we like for the longer term, at least seasonally, or maybe and during the summers, maybe on weekends, maybe on times of the day. There's all sorts of variables that can be done. It doesn't have to stay exactly the same. But it's just like when we hosted the Olympics, for example, here in Vancouver, and we had to drop our car use by 30%. And we did what I called at the time the largest traffic trial in North American history. And we learned a lot. And the conversation became easier about trying different things after we hosted the Olympics and the world didn't end, when we closed all these streets and opened street parties and did things like that. Any kind of major change, whether it's a celebration like the Olympics or a crisis like this, can be an opportunity to experiment. And I just use the word opportunity. I don't want to use that word, but it can be a chance to build a culture around trying things, experimenting, not being so risk averse, etc., and then letting the public, to a certain extent, the data and the public, be the indicators of success or failure. What I'm afraid of is that there are sort of three kinds of Canadian cities being created out there in terms of how cities are responding. And we're going to be talking about these three kinds of cities 10 years from now, when we're looking back at this turning point. City type number one is the cities that have done nothing. And the only thing they've exercised in this process is their ability to make good excuses and say why bureaucracy has to prevail or things can't happen or what have you. So the only thing they've gotten better at is making excuses. They will be, at best, they're the cities that will have missed the opportunity or the responsibility to do better. The second category are the cities that did it, but did it reluctantly or maybe with some seriousness, but always anticipated it to be temporary, never connected the dots between what they're doing temporarily and what they frankly needed to be having conversations about in terms of urban pollution, livability, deaths from speed, deaths from asthma and preventable diseases, et cetera, et cetera. They'll have missed the the connecting of the dots of that, and most of it will go back to normal. And if anything, they will have a better culture of experimenting in the face of crises, but they will have missed the opportunity to transform their cities. The third category are the cities that are already talking about permanency, that will look back at this like European cities looked back at the 1973 oil crisis and say that was the turning point where we changed direction. We'll literally be showing before and after pictures of how the cities transformed after this crisis. Those will be the winners. 10 years from now, we will be talking about those cities as the winners. In the meantime, we need to be very, very vocal in, frankly, attacking the narrative that's anti-density, anti-transit, etc. Because if we're not vocal, the other sides, the car companies with their ads, the sprawl purveyors out there are already being loud and persuasive. They're writing op-ed pieces, etc. And we need to be very vigorous with the data and the knowledge about how cities need to function even better than they do moving forward from this pandemic. Because if we double down on the kinds of things that put our foot on the gas towards the climate emergency, this is a dress rehearsal for even greater pandemics. This is a dress rehearsal for even greater crises, not the least of which, ironically, is that one of the consequences of climate change is more and worse pandemics. So if we go in the wrong path, our future is going to be much worse.
Well, thank you all. I'm going to hand the baton over to Kelly Tehan, who's from Parachute. She's been monitoring the questions that have been coming in, and they're coming in fast and furious, as she said. So Kelly, I'll hand it over to you for some question and answer.
Thanks very much, everyone. It's been a wonderful conversation. And again, there are a lot of questions. We're not going to be able to get to each one of them, but let me try to group a few together. We have several questions. We've been talking mostly about larger urban areas, and we've had a few questions honing in on what is the role and how can small cities and suburban areas respond. When we're looking at these road closures, what are some of the issues you've seen, whether it's best practices or challenges that smaller cities, we've had one inquiry specifically from Halifax and a couple of inquiries about what should we be doing? The idea of, yes, these major transit centers, all of these big cities, but what about the smaller cities and also suburban settings? What are some of the best practices they should be looking toward?
Bartek, did you want to start?
Well, I think that many of the things that I was describing, I think they're applicable everywhere. Traffic is down pretty much everywhere, from my understanding, including in more suburban areas that were built around the automobile. So most places now have this opportunity or the chance, as Brent was saying, to reallocate space. So I think that a suburban municipality that has very wide streets, it can also consider allocating more space for cycling. Often these places are very hostile to cycling. And I think also that these concepts of shared streets, where with very slow traffic, are also applicable in suburban areas. So, maybe rethink your streets. What activities are allowed on the street? Is the roadway just for cars, or can it be also shared? I think people everywhere will be more constrained in this year and maybe next in terms of vacation. I mean, they won't be able to go far. So maybe it's time to think how we can offer space to people so that they can experience their own city in a different way.
Right. Kelly, maybe I'll get you to ask another question just so we can get a few more in. We only have a few more minutes.
A very specific one. This would be for Linda. We have someone asking, where can we find statistics around collisions and fatalities in relation to vehicle volume in Toronto? So is there a good central source for that information? That's
such a good question. In relationship to vehicle volume, no. That's something that we struggle with a lot. It's hard to get good volume data anywhere. There are police reported collision reports on open data, but it's only for the killed and the severely injured related to visionzero. So you can get collision numbers on the open data portal. Nothing is related to vehicle volume. And that's something that we try and do, is figure out what the volume, our denominators as we call them. We know what the numerators are. For the most part, I'm saying for pedestrians, the cycling collisions are much harder to pinpoint because a lot of those aren't reported to police. So there's issues around getting really accurate numerator data for cyclists. We can get decent pedestrian numerator data. In terms of actually figuring out the volumes of people walking, the volumes of cars driving, that's a whole challenge that researchers work with frequently.
Great, thanks.
Several questions also around communications. One participant from Calgary is talking about apparently there are road closures happening, but people don't know where they are. There's not a clear communication plan. Several questions around communications. How do all the people on this call, people who are interested in advocacy, how do they unify their message? How do we work together to advocate for these kind of making some of these temporary changes permanent? So issues around how do we communicate both in the temporary now and moving forward in the future to try to get this message out around greater access and greater accessibility for pedestrians and cyclists.
Brent, maybe you want to take this question?
Okay. Well, in the context of the Calgary example, especially when pilots are turning on and off, it can be a communication. It's really important to get the communication out there about when they're closed, when they're not. For example, when Calgary did its pilot closing, I think it was 5 or 6 of their major roadways, I was struggling to figure out, well, is it just on weekends? It was a weekend pilot. There wasn't really an announcement about it being turned off because the roads reopened during the week. So yes, it goes without saying to say you need a good communication strategy. What I found is the best communication strategy is your leaders, like the Cuomo or the Nenshi in Calgary, being out there saying, this is what's happening, this is our vision, this is why we're doing it. Because earned media is better than anything that a communication strategy will do in terms of putting something on a website. When something is high profile, that's how people hear about it, because they're sure not going to the City of Calgary website to get information. I think the communications challenge we have about how making sure this will all stick, maybe I'll answer this question with an overlap of the question about mid-sized cities and suburbs. I think it's particularly important to have a loud and common voice about some of the things I've been talking about in smaller cities and suburbs, because although they have many of the same challenges, many of the same physical geometries that create challenges around physical distancing in places like Main Street, etc., what they don't have often, and I do a lot of work in small and mid-sized cities and in the suburbs, is a pre-existing observation of the benefits of density in transit, because they're probably having the conversation about whether they should densify right now, whether they should redirect their transportation thinking towards public transit, and they don't already have the success story locally to build on. It's in those kinds of cities, the mid-sized cities and the evolving suburbs into more urban conditions, that I actually think the communication challenge that I'm talking about is most important. Because if all the suburbs revert back to car thinking, that's where most of the people live in Canada, and that's where most of the people are still going in Canada. Mm-hmm. And the small cities, we have a lot more small cities of that scale and vintage than we have big cities in Canada. So where goes the suburbs and small, medium-sized cities, so goes Canada, even though we tend to give a lot of attention to our urban places.
I could follow up.
Yes, go ahead, Bartek.
Yeah, I would like to, I would confirm actually that from my experience with Villa Quebec, we worked with a lot of small cities and suburban municipalities. Often the first transformative project is the hardest one to do. And it's true. What I've heard repeatedly over the last many years is once you get one in, the next one is a lot easier to do, because then people already have an experience of what it is and of all its benefits. So maybe that's another way to see this. what's happening right now is that we have this chance to maybe bring forward, accelerate some of these transformative projects and get people to experience them. And I think the knockoff benefit could be that in the future, once people know what these changes are, they know what a shared street is, or they know what a protected bike lane is, it'll be easier to communicate and easier to convince them that this is a thing we should pursue.
I'm gonna have to, sorry, Linda, I'm gonna have to wrap it up. We're over time, and I want to try to stick to the time. But I think what this has demonstrated is there is a huge appetite around this issue, that there is a momentum that's building right now. And I think, you know, from a communications perspective, and, you know, galvanizing everyone around this issue and being able to push it forward and working collaboratively with our local stakeholders, you know, Parachute really sees this as, you know, something that we want to make a priority and help as best we can. So this is just the beginning of our work with this, and hopefully we'll be able to either, you know, lend our voice to efforts that are already going on, or that local communities start, or we can help start those. So more to come, definitely only the first conversation. I do want to tell participants before we lose them, that this recording will be on our website on the Vision Zero section, and we will also send all the participants the link to the recording. It will also be part of the next Word on the Street publication that we anticipate getting out next week. I'll also let you know that there's another webinar. This is a series. So this will be next Friday at 2 p.m. Eastern. And it will be focused on imagining car use and road safety post-COVID-19. We have some feature panelists, Robin Mazunder from Vanier, who is a Vanier scholar and an urban neuroscientist from Waterloo, and Craig Milligan, road safety engineer and CEO at Microtraffic in Winnipeg. So if you're interested in hearing more on this, register at parachute.ca /webinar, and you can join us next week for this conversation. We'll certainly be monitoring. I know Kelly's gotten a lot of the questions down. You know, if there's a threshold of ideas or questions that center around a particular issue, we will be happy to schedule more conversations like this. So I want to take this opportunity to thank Linda, Bartek, Brent. Thank you so much for joining us. It has been a really interesting and informative conversation, and we appreciate your perspectives and giving us this time today. So thank you, and have a good rest of the day.
Thank you.
Thank you. Bye-bye.